All right, with that, we'll go ahead and get started. So welcome, everybody. Welcome to the 2021 Open Enrollment Benefits for Level Up. We're going to go over quite a few items today and some changes that are happening effective 1/1/21, first of the year. It's around the corner already. On the screen, you'll see the agenda. So we're going to go over the new benefits with Blue Cross Blue Shield, the existing benefits with your dental, vision, and then changes coming with the life insurance and the voluntary options as well. The open enrollment for Level Up begins today and will terminate on October 28th, 2020, which means you have that amount of time to review the options, make a selection, and return the enrollment form to CBR for processing. We'd like to have everything back in the office by the 28th. If for some reason you cannot return it, please let us know and we'll extend if necessary and case by case. Blue Cross Blue Shield has asked us to submit everything to them by December 3rd to guarantee ID cards by the first of the year. So we'd like to get everything submitted to them as soon as possible. The benefits that we're going to review are effective January 1st, 2021 until December 31st, 2021. The benefits that you will elect are for a full calendar year, and you cannot make any changes unless you experience a qualified event. So here on the screen, you see some examples of that: marriage, divorce, separation, birth of a child, adoption, loss of coverage, things of that nature. It's just as a reminder, you only have 31 days to notify the CBR HR team of any of those qualified events. If you think you've experienced a qualified event, please reach out to us as soon as possible. If you exceed the 31 days, then you'll have to wait until the next open enrollment period to make any changes to any of those pre-tax deductions, such as medical, dental, vision. In regards to eligibility, all Level Up employees are eligible for all of the benefits, aside from yourself, legal spouse, domestic partner, and children up to the age of 26. So we're going to jump right into the medical. So the Aetna plans are terminating on December 31st, 2020, and the Blue Cross Blue Shield plans will be effective January 1st, 2021. So we're going to go over the first plan is the PPO 2000. So all of the plans are PPOs. They're all going to be national networks, and if there's anything otherwise, I'll let you know. But PPO means it's basically an open plan. You can self-refer to specialists. You do not need to select a primary care physician. First plan here, it's got a $2,000 individual deductible, $4,000 family deductible. Should you meet that deductible in a calendar year, you're going to go into the coinsurance or cost share with Blue Cross Blue Shield, which is 80% Blue Cross and the member 20% until you reach that maximum out of pocket. Keep in mind the maximum out of pocket reduces with every single copay that you make. So as you visit the doctor for urgent care, emergency room, primary care physician, anything of that nature, it starts to deduct from the out-of-pocket maximum. If you go into the hospital or surgery, things of that nature, and you pay your deductible, that also comes off of the out-of-pocket maximum. So keep that in mind. On this plan and all of the plans, your preventative care is going to be covered at 100% with no out-of-pocket cost. On this plan, should you need a regular doctor visit, a sick visit, a walk-in clinic visit, it's going to be a $30 copay, and specialists that you can self-refer to is a $60 copay. Telemedicine on this plan, which is your doctors that you use either via Skype or a phone call, is at no cost to the member and dependents, and it's on the copay plans. And then urgent care is $75 copay. Emergency room is $250 copay. And try and stay out of the emergency room whenever possible, because that's when your deductible is going to kick in. And then you have copays available for pharmacy as well. So your generic is a $10 copay, brand name $35, non-preferred brand name is either going to be $60 or $120. And there are 4 tiers in the specialty medication. So in the email that went out, there are summary benefit of coverage that will outline all of the 4 tiers, or the 4 tiers for the specialty drugs or specialty medications. So there's additional 4 tiers for anyone using those specialty type medications. And then the next plan here is a $3,000 high deductible health plan. This is an HSA qualified plan, which means if you are enrolled in one today and you have an open HSA and you're already contributing money, you can enroll in this plan and continue the same contribution. You do not need to re-enroll with UMB Bank. That will carry forward. On this plan, it's a $3,000 individual deductible, $6,000 family. And then should you meet that deductible in a calendar year, you're going to go into that cost share. And this one is a little bit richer, 90-10, so you'll pick up 10% of the cost until you reach that out-of-pocket maximum. So this plan is deductible first, which means the member is responsible for all costs up front up until the deductible, with the exception of your preventative care, preventative medication, and FDA-approved contraceptives. Those are all free prior to the deductible. If you have any questions in regards to your prescriptions, if they fall under that free category, I will happily send you the information, the link, and the list of medications and FDA-approved contraceptives that are going to be free prior to the deductible. On this plan, the copays do apply for the rest of the pharmacy after your deductible. So keep that in mind here on this high deductible health plan. This one pairs nicely with the HSA account that you can use to pay for those services and pharmacy. Any question on these two plans? Okay.
Yeah, I've got a question. This is Joe. I'm trying to map them to the enrollment form. Which one is that? Just take an example. Which one is the PPO 2000 on the enrollment form?
I'll have to bring up the enrollment form. I don't have it in front of me. Danette, do you have that?
I'm not sure if she's on, but okay. I'm trying to figure it out because there's plan 1, 2, 3, and 4, and I'm just trying to figure out which ones are which here.
I can bring up the enrollment form at the end of the presentation, and we can walk through that.
Okay, that'd be great. Thanks.
No worries. All right, we'll go over the next couple plans here also being offered. The next plan is a PPO 3500. This is also a high deductible health plan that is a HSA qualified plan. It's a little bit higher deductible on here, 3500 for an individual, 7000 for the family. Then the coinsurance goes to 80/20. Your out-of-pocket maximum, should you meet that deductible, goes to $5,950 for an individual, $11,900 as a family. And again, everything is member responsibility with the exception of preventative care, preventative medication, and FDA-approved contraceptives. So the member is going to be responsible again for all costs on the high deductible health plan, similar to the one that we talked about before. So again, you use your HSA dollars to pay for services. Once you reach that deductible, then that's when Blue Cross Blue Shield starts to kick in 80% of cost, and you pick up 20 until the out-of-pocket maximum is reached. You do have those copays available for the pharmacy, but again, that is after the deductible, with the exception of the preventative medication and FDA-approved contraceptives. The next plan here is a $6,350 individual deductible. This is also a PPO plan. This is not an HSA qualified plan. So with plan 1 that I went over and this plan, you compare an FSA or flexible spending account, a little different than an HSA. So the reason this one doesn't qualify for an HSA is because it has co-pays associated. So copays for your regular doctor visit on this plan is going to be $25, and then your specialist $50. Urgent care is $75. Emergency room is $250, and you also have the free telemedicine with this option for your regular doctor or diagnostic type visits. Counseling or psychiatry is also available at no cost on plan 1 and plan 4. Your copays apply here for your pharmacy before your deductible. So again, your $10 for generic, $35 for brand preferred, and non-brand preferred. Non-preferred brand is $60 or $120. And then again, your summary benefit of coverage will go over the 4 different tiers for the specialty medication. So those are the 4 medical plans that are being offered at this point. Does anybody have any questions? Okay, I'm going to continue to move forward. So we're going to go over the HSA and excuse me, the high deductible health plan. Just a few notes to make. If you're enrolled today in a high deductible health plan, you do not have to open a new UMB account. If you're going to enroll for the first time, then yes, you have to open an HSA account. We partner with UMB internally. It makes it easier for us to deposit any of your HSA election to go right into that account. It's important to get it open before the first claim hits, because then that will allow you to continue to add pre-tax dollars into that HSA account to pay for any claims. If you wait, let's say mid-January, February, and you've already had a claim hit on those high deductible health plans, you can no longer use those first HSA dollars to pay for those past claims. So it's important to at least get it open, even if it's not funded, even if there's no money in there, it's just important to have it open. So a few items to point out here in the bold, it's a couple bullet points down. So each year the IRS increases the amount of pre-tax dollars that an individual may put into an HSA account. For the 2021 plan year, they've increased it to $3,600 for an individual, or $7,200 for an individual plus. So if you enroll as an employee plus spouse, or an employee plus child, or an employee plus family, you may set aside up to $7,200 into an HSA account. And then if you're 55 plus, you can add an additional $1,000 to either one of those categories, an individual or family, to and they call it the catch-up provision, because once you enroll in Medicare, that excludes you from being able to open an HSA and fund an HSA. You can use the money that's in there, but you can no longer fund an HSA once you enroll in any part of Medicare. So that brings us to the next section, which is what qualifies an individual to open an HSA. Number one, you have to elect a high deductible health plan, which you have two being offered. You cannot be covered under a non-HSA or non-high deductible health plan. For example, if you're covered under a spouse's plan that has copay for doctor visits, urgent care, or emergency room and pharmacy, that excludes you from being able to open an HSA account. If you're covered under TRICARE, that is a non-HSA plan that excludes you from an HSA account. If you're enrolled in Medicare, that also excludes you, or if you are claimed as a dependent on somebody else's tax returns. Any questions on HSAs or high deductible health plans? Another note on the HSA dollars, that is your money. It rolls over year. There is no use it or lose it provision. If you happen to leave Level Up, you take that account with you. Next, we're going to go over the flexible spending account. So this account can be paired with option 1 and option 4. So these again are pre-tax dollars that you set aside in a calendar year. The biggest difference on FSA and HSA is that FSA, the credit card or debit card that you get in the mail, is front loaded with the amount that you've selected. So if you elect the full $2,500 for 2021, when you receive your Visa card with Task, or the one that you have today, will have that amount available to use immediately. And then that is deducted per pay period for the rest of the calendar year. Unlike the HSA, if you leave Level Up, you lose the funds that are still in there, as we no longer have the ability to collect those. And then there is only a $500 carryover provision. So if you have an FSA today, and you have, anything over $500, I would recommend that you spend that down to $500 so you don't lose any of that money. And then the flexible spending account, or FSA, does require you to enroll year over year. So you have to make your selection. Let us know how much pre-tax dollars you want to be loaded onto the card. You also have dependent care FSA. So dependent care is for children or elderly care. You can use it to pay providers or pay yourself back. Again, on here, there are some limits for the calendar year, $2,500 if married and filing separately. The maximum election is going to be $5,000 in a calendar year. And again, these are pre-tax dollars put into an account and available for you to use as they're deposited into that account. Any questions on flexible or spending account? Okay, some resources available to everyone that's enrolled in Blue Cross Blue Shield. First, the Blue Care Anywhere. So this is the telemedicine provider for Blue Cross Blue Shield. If you're enrolled in Plan 1 and Plan 4, it is at no cost. Plan 3 and Plan 2 and 3, which are the high deductible health plan, deductible is going to apply. So depending what type of service you're seeking in this case. So medical counseling psychiatry is free to all members that are on Plan 1 and Plan 4. All of the members have access, but deductible does apply. And then also I would recommend once you get your ID card, you go into the bluecareanywhereaz.com, register, download the app to your telephone so you have that available to use as soon as it's needed. Next, we're going to go over the dental options that are available. No change to the dental options that are available today with Delta Dental. So the first plan is your typical PPO dental plan. So where you have an allowance or a dollar amount to use toward dental services for a calendar year for everyone enrolled in the plan. In PPO base plan, you have $1,500 to use towards your dental services. Your preventative care is still going to be covered at 100% with no out-of-pocket cost. And then your basic services, such as emergency extraction or cavities, it's an 80-20. And then your deductible is going to kick in at that time. So it's $50 for an individual and $150 for the family, and that's once in a calendar year. Now, if you use the major services, endodontics, periodontics, root canals, crowns, things of that nature, it's a 50-50 cost share. And if you have not paid your deductible at that point, you will have to pay for it when those services are rendered. And then finally, on this plan, you have an additional $1,000 to use towards child orthodontia, and that's a lifetime benefit. Then the next plan is the DHMO plan. This plan also has preventative services covered at 100%. No annual maximum on this plan, and all services are a fee schedule, which means you look up the dental code and it tells you exactly how much out of pocket you're going to pay. Now you can use your HSA or your FSA to pay for these services for yourself and your dependents. So this is an example of the fee schedule for the DHMO plan. You do have to select a primary care dentist, and each member in the family may have their own primary care dentist. They're not all obligated to go to one, and then you can change it at any time. If you're enrolling for the first time in the DHMO program and you do not select a dentist, Delta will appoint one based on your home zip code. You can go in and change it on the system or by calling them, and they will happily change the dentist for you. So as you can see on the screen, there's a bunch of dental codes with a D. The first section there being the diagnostic section at no cost to the member, and then restorative, there's some charges based on what procedures are done. And then the other side of the screen is the orthodontia. So orthodontia for children is listed on here. I believe it's $1,900, and then orthodontia for adults is $2,100. And these are dollar amounts that the member pays. So this is your out-of-pocket cost for those services. The reason you have to pick a dentist and stay with them is because they've agreed to this contract to not charge any more than what's listed on this fee schedule. Any questions? Okay. Additional resources available through Delta Dental. If you haven't gone into Delta Dental of AZ and created a profile, I highly recommend it. It'll help you, one, review how much of the benefit you've used today to find a dentist and other resources available. The vision plan, no changes here to the vision plan. It is IMED using the Insight Network. So same thing applies. Your exam every 12 months is a $10 copay. Keep in mind with your eye exam, if, for example, you went on July 1st of 2020, you will have to wait until July 1st of 2021 to go in for that eye exam. It is a full 12 months for the eye exam. Your frames, you have a $120 allowance, and then anything over that, you get a 20% discount. Your plastic lenses, single vision, bifocal, and trifocal, you're going to have a $10 copay. Contact lenses, it's an $80 allowance, and then 15% off the balance. And then medically prescribed or medically necessary contact lenses are always going to be covered in full. Next, we're going to go over the options that are changing for your life insurance. So today, Level Up does provide $15,000 of life in AD&D for all employees. So that coverage is moving over to MetLife. So you'll have to complete a new beneficiary form and get that over to us so we have that in file. And then if you're going to be purchasing additional life insurance, or you just want to keep what you have, if you have voluntary with Unum today, that is going to be transferring over. But we do want you to complete a form and a new beneficiary for those voluntary products as well. And we'll go over those forms too. So a couple of things here. So all employees working 20 plus hours are eligible for the life and AD&D. It is 5 times annual income up to $500,000. The guarantee issue for new employees is 5 times annual earnings up to $200,000. If you have life insurance already today with Unum and you want to increase it, you may do so up to $100,000 with no questions asked. For your spouse, it's $25,000 of guarantee issue, and for children, always guarantee issue at $10,000. One of the biggest changes with MetLife is that there is no benefit reduction. In today's plan with Unum, as we start to age, the benefit reduces at age 50, I believe, and then age 65 again. So with the MetLife plan, there is no reduction of benefit. Short-term disability, it also is moving over to MetLife, and if you're enrolled in it today, we just ask that you complete a new form and it will roll over, so you will not be subject to evidence of insurability or any questions like that. We just need to have a new form on file. So short-term disability begins on the 14th day of disability, illness, hospital, illness, things of that nature. And the benefit pays up to $1,000 a week, which is up to 60% of your pre-disability earnings. And the benefit does last for 11 weeks. Now, there is a pre-existing limitation for both the short-term and the long-term disability. It's called a 312. What that means is if 3 months prior to the effective date, you saw a provider, took medication, or were diagnosed with a condition that you went out on leave for, let's say in 2021, it will not be compensable. You will have to wait for a full 12 months. So if you're pregnant today and you're going to enroll hoping to get the short-term disability because it's a pre-existing condition, it will not be covered. Long-term disability begins after 90 days or at the termination of the short-term disability. Again, 60% of your pre-disability earnings up to $7,500 a month. This benefit lasts until age 65 or normal Social Security retirement age. And again, the same 312 pre-existing limitation applies. Any questions? Okay, some resources available to all of Level Up employees. You have 2 EAP services that you may use at no cost to you. The first one is Support Link. So this one offers 3 face-to-face visits per issue, either via Skype, telephonic. You can go online and register. Support Link does offer a lot of resources, discounts for the members and families. It is a really good service to use as needed, especially during these kind of difficult times. Not kind of, they are difficult times. And there is no reporting sent to your employer to us. We don't know who calls. We don't know the reasons why, people are utilizing EAP. Again, it is available to every employee and their family members. They can call at any time. It is a service that's available 24/7, 365. So anytime you feel the need to reach out for any reason, pick up the phone and call. So the consultative services can be anything from, a problem with an employee, finances, elderly, the children, etc., just dealing with day-to-day items. And then you also have an additional EAP service through MetLife. So this is a new program for Level Up employees because your employer is paying for $15,000 of life insurance. So you also get the MetLife EAP, again, valuable resources for all of the employees at no cost. Additionally, you have what we call Travel Assist. Travel Assist is helps the member, the covered member, should they travel 100 miles outside of their home zip code and they run into an issue where they lose their wallet, you're traveling abroad and you lose your passport, you can call the Travel Assist program and they will help you navigate either finding medical care, trying to help replace your visa, get you back into the United States, whatever the situation is. Really good resources and services available to all the members there. Aflac. So Aflac, if you're enrolled with Aflac today, there are some changes coming in 2021 that may affect you. So if you're enrolled in the accident policy, the hospital policy, or the critical illness policy, we are moving to what we call a group plan, which means there are set rates, and the Aflac team is going to be reaching out to each of those members. And my understanding is there is going to be some savings to anyone who is enrolled. If you are not enrolled and would like to enroll or like additional information, there is a callback sheet in your packet that we would like you to complete and return so you can, Aflac representative can go over the options that are going to be available 1-1. We are going to have a 1-800 number available for Aflac enrollment, and later on we'll send that out to everyone so you can call and say I want to learn more about how the hospital plan and the rates. Again, a substantial savings there for the members. But while that happens, just fill out that interest form and send it back to us so we can reach out to you. Pet healthcare, it's still an option. There is a slight increase for 2021. If you are enrolled, your pet is enrolled in this, you'll see, I think it went up $1 and change per month. You'll see that in your enrollment packet. Legal Shield and ID Shield, again, if you're enrolled today, that continues forward, no changes to the rates. And if you'd like to enroll, in your enrollment packets, there is a sheet that gives you the web link, because you do have to register or enroll online, similar to the pet healthcare. And then next step. So I think I'm going to pause here and bring up the enrollment packet. And if you have any questions, please ask. One second, please. Okay, this is the MetLife form that needs to be completed. Again, if you are enrolled in the voluntary life insurance and you need to know how much you have, please reach out to us and we'll be happy to let you know how much you have in the event that you want to increase it. If you don't want to increase it and you know how much you have and you just want to keep it exactly the same as you have today, you don't have to fill in your higher division, any of that information, just your personal information here on section 2. If it's a new enrollment or change in enrollment, indicate so, or you can just write at the top, leave the same, and we'll know to just to carry forward what your current benefit is. This is for the supplemental. If you're adding for yourself or your spouse, complete this section and add however amount you want to enroll in. Again, short-term and long-term disability here. And as you scroll through it, in Section 5, you will see the beneficiary designation form. If you are legally married in the state of Arizona, because it is a community property state, your spouse will be your first beneficiary, and then you can break it down however you want to after that. And then as we continue to scroll through the packet here with MetLife, again, it just goes over the amounts that are available to you and the spouse, and then it breaks it down here. This is the monthly cost per, 10,000, 20, 40, 50, 100. But again, you can increase it. If you want to do 60 or 80, you can also do that. Let us know. And if you want to know what those premiums are, will let you know what those premiums are. And then the spouse premiums are directly below that. Remember to add the AD&D for yourself and the spouse, so it doubles the amount of coverage. And then again, short-term disability, if you need information of the cost, it's going to be also outlined in these packets. I apologize for all the scrolling. Trying to find the per pay period deductions. Here they are. Okay, so these are how you're going to calculate your cost depending on your age, of course, your income. So that'll tell you how much your pay period deductions are going to be for those types of coverages. And then again, here's the legal shield. Here is the information that you need to enroll in the legal shield or ID shield. Pet healthcare, this has the updated premiums here at the bottom. So if you have it today, I think it's $10 and change. It's going up to $11.66. At the bottom of the page is the website where you go and enroll, and it will get that information and do payroll deduct. This is the interest form for AFLAC. So if you already are enrolled in AFLAC today, an AFLAC representative will be reaching out to you to let you know if there's going to be some savings for you. If you want to enroll, please fill this out and return it to us so we can have an AFLAC representative call you and go over those benefits and what the per pay period or monthly cost is going to be. And then this is information on the EAP with support link. It gives you information on all of the services that are provided to you at no cost. Short-term counseling, legal services, referrals, financial services. The web portal is really good because it provides a lot of resources, discounts for a lot of things throughout the U.S., not only here in Arizona, but throughout the U.S. should you be traveling. And then finally, the information on the MetLife EAP. So again, I recommend first of the year, you go to those resources, create your login accounts, download the apps to your telephone so you have those available for yourself and your family as needed. I'm going to bring up the enrollment form next. Just bear with me here. Sorry about that. Just 1 second. Just 1 second. Sorry about that. It's taking me a little bit longer than I anticipated to bring that up to the screen. Okay. So on the enrollment form, we do ask if you are enrolling, even if you're just enrolling the current members that you have, family members, that you complete the enrollment form, your information, your dependent information. We do need Social Security numbers on the form. We are obligated to collect those. So please let us know, you know, for some reason you can't supply it, let your HR representative here at CBR know immediately, and then we will work with you when it comes to that. I want to point out the bottom of the form here, section F. If you are waiving the medical, we do ask that you provide a reason why you are waiving the medical, and then sign this acknowledgement here at the bottom. So we do need to have this on file for every single employee if you are waiving. If you're covered by a spouse's plan, TRICARE, a different type of coverage, your own coverage, we just ask that you let us know so we keep that internally in our files. Section D is, Section E is your acknowledgement of enrollment for the medical, dental, vision, acknowledging pre-tax deductions. Section D is going to be the dental and the vision. This gray box in the middle here is where you're going to select a DHMO primary care dentist. So there's a link here. It's an active link. If you hover over it, it'll take you to the website, and you can enter your home zip code, and it'll help you bring up all of the Delta Care USA DHMO dentist. You can select one. There's a code. Enter the facility code in here. If you don't want to do that, or you'll just wait for Delta Care to assign one to you, that's fine. Like I said, Delta will assign one based on your home zip code, and then you can change it at any time, either going back to the website or giving Delta Dental a call. Then going over your enrollment options for the medical, bring up the plan form. Plan 4 is going to be the same plan that's on this presentation here. It's going to be the PPO 6350, so that's going to be plan number 4. And I don't see the other plans on here unless they're named wrong.
Yeah, that's what I was confused about. I was trying to
I can see your point. Okay, plan 2, the PPO 2000 is going to be plan 2. That is correct. So plan 2 is the PPO 2000, but we're missing the 35 and 3035. So I'll get this updated immediately and send it back out to everyone. I do apologize for that. So plan 2.
If you're using the online link, Joe, the plans are correct. Just an FYI.
Oh, really? Okay.
Yeah.
Oh, okay, that's good to know. So the one where you enroll online.
Yeah, correct. I've gone through a chunk of it already, and it looks and everything's there, like the HDHP plans.
Okay, awesome. Okay, I apologize for that. I didn't review this before it was sent out. So I'll get this corrected, send it right out to everybody. And then you just want to look for the names, like the PPO 2000, the PPO 3000. So to your point, that doesn't match. So the PPO 6350 is on here. That's this one. And then the other one that does match is the PPO 2000, which is plan 2. Those are the two that match. We're missing the 2 high deductible health plans, and we'll get those out to you immediately. Other than that correction, does anybody have any questions in regards to the coverages, any additional resources that are needed? Okay, so thank you so much for your time. Actually, I was just informed that the form was updated and saved to the file, so I'll send that over to everybody immediately so you have the correct enrollment form in the event that you're not using the online resource. All right, thank you, everybody.